The final muscle in this little section of sort of the low back, again, it's a muscle that's located around the pelvis, but it's quite a useful little muscle to treat with dry needling in a lot of cases, especially the people that have these sort of sciatic type pain into their buttocks. Its origin is the second and third and fourth costotransverse joints of the anterior sacrum. I don't really know if they say costotransverse because costo is more for the ribs, but certainly the transverse joints as much as they are of the sacrum, and it's the anterior portion of the sacrum as well. So that basically it comes out from down here. A few fibers may sort of come out from the sciatic notch, and it inserts into a broad area sort of the greater trochanter. So it's basically running from here out to here. And when it contracts, because the sciatic nerve could run through it or under it or even over it, there's various anomalies depending on the person. When it contracts, it can cause problems and irritation to the sciatic nerve. His action, depending on where you learn or where you're talking about, is to laterally rotate the hip when and abduct the hip when the hip is flexed. But it will also, because of its direction, that can change how it works. So it can be tested really by just getting somebody to sit cross-legged and bending forwards, and they'll feel this sort of stretching in the posterior part of their thigh, and the pain is basically felt buttock down to here. Again, this sort of sciatic type pain, base of the spine, sacrum, and at times into the upper hamstrings. So that's the sort of area that they're going to feel it, and it is often the responds very, very well to treatment along with the gluteus maximus. It's a nice muscle to needle. So for piriformis needling, we get a patient lying in prone. We want to be careful we don't stick the needle into the sciatic nerve if possible. You can use a 30mm to a 50mm. Again, it depends on the size of the patient. Often, to be honest, I don't know if I'm in piriformis. Sometimes I can actually try and get them to test the muscle. Just lift your leg up from the bed, the whole of your leg. This feels more like the glutes. So just relax. So I'm going to come in just sort of the area of the greater sciatic foramen. I'm going to put the needle in medial to lateral direction to try and avoid the nerve. I'm going to work slowly, and I'm going to ask the patient or client for feedback. And then I'm just going to tap the needle in and go in and twist the needle and leave it. Again, I will check, are you getting any zinging pain or not, and carry on. Medial to lateral direction, going out towards the greater tuberosity, around the area of the greater sciatic foramen. So that's the needling for piriformis, and we're going to have a look at that at a little bit closer angle. So for piriformis, again, maybe a longer needle, 30mm may suffice. The muscle is located lateral to the greater sciatic foramen, so needling will probably is suggested in a medial to lateral direction to avoid the sciatic nerve. But I've also worked in the opposite direction from lateral to medial. You need to work slowly and look for patient feedback so that we don't get any problems with the sciatic nerve.